The Trump administration is pushing to reopen schools as the nation's death toll tops 135,000. Some health experts believe it's still too soon to send kids back into the classroom, but the president maintains other countries have done it, so why can't we? CBS News foreign correspondent Holly Williams looks at how other countries around the world are dealing with the issue and why it's vastly different from here in the States.
More than 1.5 billion students around the world have had their education impacted by the new coronavirus, according to the United Nations. And now many parents around the world share the same mixed feelings. On the one hand, they don't want their children to miss out on any more learning. On the other, they're worried about the risks of returning to the classroom. In Israel, students went back to school in May when the country had flattened the curve of new infections. But since then, there's been a spike in cases. An outbreak in one school in Jerusalem infected over 150 staff and students. But opinion is divided about how much schools contributed to the surge in new cases. Professor Arnaud Fontenay is an epidemiologist and told us there's evidence that the risks involved in reopening schools depends on age.
Primary school age children are less contagious to others compared to, for instance, adolescents or adults.
President Trump tweeted that Germany, Denmark, Norway and Sweden reopened their schools with no problems. But most European countries waited for their infection rates to drop before sending children back to class. In Taiwan, schools were only closed for 2 weeks, and though there are lots of measures in place to prevent new infections, life has pretty much gone back to normal. But with tough measures from its government, Taiwan has had fewer than 500 confirmed infections and just 7 deaths, so may not be comparable to the US. In the UK, with the highest death toll in Europe, a group of paediatricians said keeping schools closed will exacerbate inequality and risks scarring the life chances of a generation of young people. Professor Fontenay is himself a father of 4.
Were you worried when you sent your children back to school?
They can wear masks, they can wash their hands, they can keep physical distance. It's a matter of self-discipline, and they have to learn it.
But the professor also acknowledged that maintaining that discipline, as he put it, is much more difficult for younger children. Holly Williams, CBS News, Istanbul.
For more on this, let's bring in Paul Romer. He is an economics professor at New York University and a co-recipient of the 2018 Nobel Prize in economics. Welcome, Professor Romer. It's great to have you with us. So your ad published in the Wall Street Journal earlier this month emphasizes the importance of testing in sending children back to school. Do you believe that is something that can be achieved in the U.S. in the short time frame we have before the fall is upon us?
It is feasible if we committed ourselves and if the nation committed resources to make this happen. I'm in contact with 2 different firms that are producing what they call point-of-care tests. Tests you could actually run in the schools. You don't have to send anything out to a lab. One of them has a full PCR machine that's about the size of a toaster. The other has another kind of device that does something very similar. They're getting contacted by, Major League Football and the soccer teams and many different organizations, but nobody from school systems is talking to them. Nobody from the federal government is saying, what would it take to scale up your devices and get them in every school when we open this fall?
And you say these tests are ready to go? They're not still in an experimental phase?
They're still being evaluated, but the underlying technologies like PCR, this is something we've been working with decades. So they've just taken a washing machine sized device, made it the size of a toaster, but all of the underlying technology is straightforward. So it should be FDA approved very soon. What we need to be doing now, though, is getting ready to scale up the manufacturing for these devices because we need them in schools all over the country.
That makes so much sense because obviously reopening schools is such a fraught issue with so many conflicting interests at play. I mean, you have the health of the teachers, obviously the health of the children and their families at home, but then of course you have the raising, economic inequality that's going to happen if lower income kids are kept out of schools because we know that online learning for them has not been as successful. So you have so many, important issues here that are dovetailing. We have to get a handle on this. One of the, one of the factors I believe is better educating the kids about how they need to sort of change some of their practices, right? I mean, are there ways we can better educate our children to be able to work within this pandemic? Is it realistic to expect younger kids to maintain things like social distancing or even remember to keep their masks on in schools?
Yeah. Well, we could use the virus as an opportunity to teach kids basic lessons about science and the importance of the facts that science can provide in guiding our daily lives. But we should also be clear that if you have people inside the school building who are infectious, we're taking huge risks. There are lots of things we can try to do to keep them from spreading the virus inside the school, but those measures, none of them are perfect. And especially this issue that came up in your earlier report about the teacher who died, teachers who might infect each other. So the essential thing we have to add to all of these plans are tests that can filter out the people who are currently infectious, keep them out of the building.
Absolutely, and the ones who might actually be asymptomatic. Well, NYU professor Paul Romer, thank you so much for joining us. We really appreciate it.
Thank you.